let's try to get, now Stefan was on. Let's see if Danielle is available. And she's actually been on Firefox with me a bunch of times, different topics. And we are waiting. Hopefully she will occupy. Hello! Hello. I'm so excited. Firetalk is working. It's actually working. Okay. So Danielle, I think you've been listening to most of this. And I'm kind of, okay, for those folks who don't know you, give us a minute or two about yourself. Have you and Hugo met yet? No? Introduce yourself, Danielle, introduce yourself to Hugo, and then, I don't know, ask a question or sound a theme.
Hi, my name is Danielle Siarri. I'm Nurse Informatics Specialist, and I'm actually in Malta right now. And I guess my question is, I've always been fascinated when it comes to healthcare in Europe. I've been coming to Europe since 2005 and going to different hospitals all over Europe, seeing what's their workflow, you know, how are they charting, how's the process, how's everything going. One thing I was always fascinated about, whether I was in Switzerland or France or Spain, was if, say, someone was skiing and they came from Spain and they went to Switzerland, like how that process worked. How did their data and their information go from Spain to Switzerland and then back to Spain? Like how that worked when it came to electronic healthcare records. So that's one of the things that I'm really fascinated about. I wrote a blog piece about, and hoping to learn more when I'm here in beautiful, as you can see, the sun is setting in Malta.
Super, super. You know, I was on a Firetalk, a couple of Firetalks ago with Danielle, and it was actually a company out of Portugal that does wearable sensors, biosensors, EKG, EMG. It's open source hardware. It's like $200 for the board. And then Danielle came on, and then we had a really interesting conversation, not so much about technology and how do you get the data from one place to another, but about culture. And that is, so she, you know, of all the people I know, she's probably been, I mean, she'll tweet, and she'll tweet from Barcelona, from Las Vegas, from Montreal. And so, and I think, you know, I'd like to hear a little bit about, Danielle, give us a minute on culture and healthcare, and maybe a little bit about IT or workflow. Do you have, because I know you have some opinions. Could you expound, please?
No, it's a new phone.
Oh.
Yeah. So, let me try to mic up here. Culture is a big piece when it comes to healthcare and health IT. And I've been to about 30 countries. So I've seen, not just in the countries, but you could see 30 different versions in one country. You can go to Italy, and every little, you know, we're in Switzerland, canton, province, area, county, it's going to be completely different. And you have to really understand the culture before you can interject any change. And that's the big piece. If you don't understand the culture and you want to make, you know, put in electronic healthcare record, add, you know, mHealth, you don't understand the people and how it really works behind the scenes when people are by themselves and it's 1 o'clock in the morning and they have to make something work, then permanent change won't occur. So that's the biggest thing I've learned in my travels the last decade, is really going to the culture, really understanding how things work, from the end user all the way up. How do things come together? What are their policies? What are their politics? And if you can understand that and you do really good initiation planning, then you can make real change occur. You can never come in with your ideas and your philosophies and your culture and put that on the occurring situation. You'll never have lasting change in that way. And then it'll actually be worse, because anytime anyone else comes to bring change, they'll be least likely to accept it. So that's kind of my point of view of my decade of travel.
Hugo, thoughts?
Well, you're perfectly right. First of all, on the change, the continuous change, as they say, nothing changes constant. And secondly, yes, that's a lesson I learned the hard way, that if you come in with thinking that you're going to change the world with the way you think things are done, without understanding the people you're working in and where they're coming from and why they do things the way they do them, you don't get very far. This morning we were talking about my health report at a seminar. One point I made was that we realized at the point that we couldn't be totally electronic, and some people needed an offline paper-based consent form, and because they simply didn't want to engage with the system while their doctors wanted to. And once those patients signed the paper form, their doctors were empowered and they were happy. We couldn't insist on everyone having to do it electronically. And once we understood where people were coming from, the system really took off. So you're right. You have to understand the dynamics of the situation, and every country is different. That's one certain thing which I've learned from Europe. I really enjoy speaking to people from other countries all over Europe, because we have shared values, but we also have cultural specifics which are different from each other. You really can't understand the way a German does things unless you bear in mind why Germany is what it is today, and the same for France or Sweden or wherever.
Hugo, I want to be respectful of your time, because I know you have a big conference that you're planning, and past planning, and now getting ready for. And so I'm going to let you go, even though I have a bunch of other questions. But maybe I'll catch you in person to do that. And thank you very much, Hugo, for creating an environment in which so many people can learn, and which so many people obviously have learned. If Stefan is any evidence. Thank you very much, Hugo.
Thanks, Hugo.
Thank you.